handling in the healthcare setting is part of daily life for the caregiver. We use the right equipment and techniques to provide safe and high-quality care. Slide sheets are low-friction devices. When used correctly, can minimise the risk of injury to the caregiver and the resident. In this video, we will consider how to position slide sheets under a resident and how to use them to move a resident up in the bed, roll a resident, and carry out a lateral transfer. We will also address how to remove the slide sheets from underneath the resident. Before you position the slide sheets, check for signs of damage or wear and tear. Also check that they glide easily against each other. Ensure that the slide sheets are long enough so that they go from the resident's head to their heels to avoid any skin shear or friction that may occur. If they do not reach their heels, a smaller slide sheet could be positioned under them. If you only have one slide sheet, ensure that it is the appropriate size when folded and that the opening faces the direction of the movement. However, it is always best to use two slide sheets together, and in this video we will be demonstrating all the transfers with two slide sheets. The rolling method is commonly used to position the slide sheets under a person. Bring the bed to a safe working height for both caregivers so that they do not have to lean or bend over, putting themselves at risk of injury. Bend the resident's leg and using your safe manual handling techniques, roll them towards you. The second caregiver can then insert the slide sheets from behind. Roll the resident onto their back and ensure that the slide sheets are centrally positioned. Sometimes it can be difficult to roll a resident due to their size or because they may be in pain. If this is the case, the slide sheets can be positioned under the resident using the unravelling method. Place two slide sheets together lengthwise. Fold the sheets as demonstrated, ensuring that the end seam is on the top and towards the head end of the bed. The folded slide sheets should then be unravelled from the head towards the feet, one fold at a time. To do this, use the hand at the bed's head end to hold the top edge and stabilise the slide sheet. Then, use the hand at the bed's foot to move under the slide sheet and unravel each fold. Keep this hand in contact with the bed. Do not lift upwards, as this will apply unnecessary pressure to the skin. If a resident is on an alternating air mattress, set it temporarily to full inflation. This can help with the method. When moving a resident up the bed, it is always a good idea to place a pillow at the headboard to prevent inadvertent injury. Both caregivers should hold the top slide sheet close to the resident's body at the upper thigh and shoulder level. The caregiver's front foot should face the direction of movement, towards the head end of the bed. Ensuring good communication, the caregiver should then move the resident up the bed. Do this with a sliding movement. Do not be tempted to lift the slide sheet. If the resident can participate in the movement, fold the slide sheets away from their lower legs and ask them to push themselves up the bed, bending their legs and using their feet. If the bed has the Trendelenburg functionality, you can use it to reduce the manual handling effort required when moving a person up the bed. Slide sheets can be used to assist in rolling a resident onto their side. Position the slide sheets using one of the methods already shown and ensure that there is enough space to carry out the roll safely. Bend the knee, then using body weight, the caregiver should bring the resident towards them and roll them. Always ensure that there is another caregiver on the opposite side of the bed to prevent an accidental fall. Use positioning aids as assessed and as required to maintain this new position. Slide sheets can also be used for lateral transfers. In this video, we will look at moving a resident from a bed to a shower trolley. Position the slide sheets as previously shown and place the slide board under the slide sheets. Bring the shower trolley into position and ensure that it is the same height or slightly lower than the bed. Also ensure that the bed's brakes and the shower trolley's brakes are fully locked. The caregiver on the pull side should hold the top slide sheet and step back from the shower trolley using their body weight to carry out the transfer, while the caregiver on the push side should assist with the transfer. Slide sheets should never be left under a resident. First, remove the bottom one by taking its far top corner and bringing it back under itself, whilst hand by hand moving down the bed. Do the same with the top slide sheet. This prevents the shear forces against the resident's skin. When removing the slide sheets after a roll has been carried out, remove them from behind the resident as there is more material at their back. If the person is at risk of sliding back down the bed, you can do this technique in reverse, from the foot end to the head end direction. Slide sheets are a fantastic resource to have in your manual handling toolkit. Remember these tips for safer manual handling when using slide sheets.